My name is James F. Mckinsey. I am a professor and vice chair here at Mount Sinai Hospital System. I'm a vascular surgeon, and I also am the systems chief for complex aortic intervention and the surgical director of our Jacobson Aortic Center. Basically, my practice is geared toward complex aortic intervention. We have excellent outcomes from our aortic program. I'm kind of quoted as saying is 80% of the cases done before we actually go into the operating room, and that's because we have the ability of TeraRecon to really plan. Here's a case that we had that had extremely tortuous infrarenal aorta as well as common iliacs and hypogastric aneurysms. When I bring a patient in, I'll actually do a 3D reconstruction using the TeraRecon, project it up, and show the patients what their aneurysm actually looks like and how we're planning to repair it. That's very impactful for the patient because now they suddenly realize that we're personalizing a therapy for them and that we spent a lot of time looking at their aneurysm trying to figure out the best therapy for them. People spend 5, 6, 8 hours doing a complex aneurysm. Patients don't do as well. We can come in and do them fairly quickly because of the advanced knowledge we have from TeraRecon and being able to plan the case well in advance, and the patients do better because of it. It is very accurate and very reproducible. We've certainly seen cases where people have used other systems and they get very different calculations, and when we look at TeraRecon, I say, no, you're wrong, and we need to use these measurements. In case after case, we found that I've been right, and I really trust TeraRecon to let me get the accurate measurements so I can treat these patients with complex aneurysms. When I look at TeraRecon, I've used it both as part of a PACS system at my previous place of employment, and now I have a single server. No matter where I am, as long as I've got internet, I can actually review the scans and give an opinion on what the options are for treatment. So I found it's been very flexible as I'm trying to manage patients both here as well as collaborating with other physicians, and then even when I'm traveling. I think one thing else that's been very helpful with this is I actually work with people that are not even vascular surgeons. I've been working with one of our thoracic surgeons that is actually looking at doing 3D modeling for tracheal prosthesis. And they're using TeraRecon now to help their calculations that they're trying to figure out pulmonary anatomy. So it's a very versatile program, not only for the vascular space, but for other spaces such as colorectal and thoracic. The other thing is the depth of knowledge of the support staff. And they're wizards at using the technology. They know every little button to twist and tweak. They can teach you how to do it. And then you can very quickly incorporate it into your own measurement skills and not have to have them there. If you need to give them a call, they're there. If you want to have them link in by the internet, they can do that too. This is a new frontier for a lot of us. Most of us don't have radiology training. And so to have that support as we come in and start doing more and more computer-based 3D modeling, but have someone that's very knowledgeable, I've found to be indispensable. So I have to give them kudos for making sure that their support staff is exceptionally well trained and very available. If someone comes up and say, what system do you use? It's very easy to say TeraRecon. The technology is extremely robust. I think as you develop new technologies or new techniques yourself, what you'll find is TeraRecon is already there and has the ability to help you as you're planning these cases. I truly feel it's indispensable, and I won't do cases without it now.